So good day to everybody. I'm going to discuss the psychological well-being of the AML patient and the AML patient's family and caretakers, but also the role of the clinical psychologist in health support. Next slide, please. We know that AML patients have to cope with multiple distressing psychological symptoms, such as depression and anxiety and fear, feelings of hopelessness and isolation, and stress reactions due to the shock of the diagnosis of AML. The often immediate hospitalization and treatment, and a certain prognosis. There is enough scientific evidence of the benefits of psychological support and psychotherapeutic treatment as part of your standard cancer care to reduce the stress, but also to prevent the development of psychological conditions and to better the overall quality of life during and after treatment. Next slide, please. So what is the role of the clinical psychologist in health support for the AML community? So psycho-oncology acknowledges the psychological side of the cancer and address the emotional response of a cancer patient, but also that of their families and caretakers. Working as a clinical psychologist in the psycho-oncology field, which is a subspecialty in psychology, includes assessing an AML patient for psychological or psychiatric conditions such as depression, anxiety, or post-traumatic stress reaction, and treat the conditions effectively. But the role of the clinical psychologist in AML is also prevention of psychological distress or conditions. So a clinical psychologist focuses on the patient's personal experience of the illness and how this experience may influence his or her behavior towards the illness and the treatment. Being diagnosed with AML and receiving intensive chemotherapy cause a lot of physical and psychological changes and challenges. Induction chemotherapy especially is a stressful period due to the unfamiliarity of the treatment, the uncertainty of the results, and decreased health-related quality. The next slide, I think that is, I'm sorry, can you move on to where there's depression? I think, no, not another one. Yes, thank you. Depression can develop either as part of the trauma of the diagnosis of AML, but depression can also be a side effect of specific treatments like chemotherapy. If you feel depressed, or even if you're diagnosed with clinical depression, it doesn't mean that you cannot cope with your illness or the treatment of your illness. And it doesn't mean that you are not strong enough. Depression is a normal reaction when confronted with a trauma. There are a couple of losses that you must deal with, like in physical losses, relationship losses, sometimes losses in your career, and especially the loss of who you were before cancer entered your life. So grieving and losses are part of depression. So however you may have been touched by cancer, whether as a patient yourself or a caregiver or a family member, chances are that you've experienced feelings of sadness, fear, guilt, uncertainty, and anger at some point. And these feelings are common and normal, but it is important to let somebody in your oncology team knows that if these feelings persist or getting worse, so that you can be treated properly for your symptoms. Look, remember that both depression and anxiety can be treated successfully with both medication, as in an antidepressant, but also psychotherapy. Anxiety can be overwhelming at times, and initially most people feel a sense of loss of control and uncertainty about the future. And again, like with depression, feelings of anxiety after a cancer diagnosis are normal, but without managing the normal anxiety, it can become dysfunctional and restricting of your functioning. It is important to talk about how you feel so that a therapist can assist you to identify and use healthy coping mechanisms at the time. If there is any history of previous psychological or psychiatric conditions, such as a general anxiety disorder or depression, panic disorder, or a bipolar mood disorder, there is a higher risk factor in developing psychological or psychiatric disorders after a cancer diagnosis and during or after your treatment. So please alert your doctor about your history. So, and to look out then for the development of a psychiatric disorder and or to prevent a psychiatric disorder or a psychological disorder, or treat it immediately when you present with that. Most people feel very tired and fatigued during and sometime after the treatment, and that can also contribute to feeling anxious or depressed. To manage your fatigue symptoms is acknowledging that you have AML-related fatigue, and secondly, not being hard on yourself or expecting yourself to perform all the activities that you did before you became ill. Active management of your energy can help you regain some control over your daily activities and roles and responsibilities. It is normal to feel overwhelmed at first, and you will need and you must use time to adjust to the many experiences and emotions, as well as life changes during and after the cancer treatment. A psychologist can help you understanding your emotions and within the framework of your illness and treatment and what to expect on a psychological level, so that you can be prepared for your reactions and still have a relatively good quality of life. So what are the benefits of engaging in a therapeutic process with a clinical psychologist or with a psychologist? So a therapeutic process, and this is really very important, provides a safe and emotionally supportive place to address all of your fears and anxieties about the cancer and the way forward. Therapy can help with coping with difficult or even conflicting feelings, psychological, biological changes, body image issues, coping with long periods of hospitalization and isolation. A therapeutic process can give you some education, some psychoeducation about the psychological impact of the illness and treatment on your life and that of your family. Therapy involves cognitive and behavioral therapy. So for you to learn new, effective skills to cope with this new and challenging journey, and helps psychological acceptance and adaptation of the illness. Talking about your fears and worries can make them feel less overwhelming. I've experienced that a big part of the psychological healing process of cancer patients was grounded in emotional expressing and the understanding of their own emotional experiences, and then for the therapist to help to normalize these feelings. So the role of the clinical psychologist in the AML population is also involving the immediate family. It can be a spouse, it can be a sibling, a child, a loved one, or a caretaker in the patient's therapeutic process. What I find most in therapy when working with a caretaker, in this case usually a family member or a loved one, is their unmet psychological needs, such as finding time for themselves, managing their own emotional and physical stress, balancing work and family responsibilities, while also caring for an AML patient. So also from the clinical psychology side, to provide for them a space to talk about and deal with their own fears and emotions. Younger caregivers often describe issues with juggling multiple roles. For instance, to be a caregiver, but also a patient of younger children, to be a daughter or a son, to be an employee and a spouse, and to juggling it with long hours in hospital. Long hours in hospital, various trips to appointments and hospitals, and for them to be away from their jobs and their households. While older caregivers describe difficulty sometimes with balancing their own health issues and ailments with that of looking after and helping the patient. Most informal caregivers, that is somebody that is not a professional nurse, are often ill-prepared for the physical and psychological care of an AML patient. And if the emotional difficulty of caregiving is left unchecked, it can negatively influence their mental health. Successful strategies that are used that help the family and have both short and long-term benefits is to include tapping into their own support system, acknowledge their own emotions and psychological side effects, have clear boundaries, and finding time to relax. So the next slide now is a bone marrow transplant. If you can just look, yes, thank you. As patients experience an acute increase in physical symptoms during their hospitalization, they are simultaneously also dealing with their prognostic uncertainty and potential for life-threatening complications. So referral for psychological assessment and interventions should be a high priority from the side of the medical team. Often, the psychological and social issues can be as challenging for the patient and the family as the present or the acute medical issues. Something to remember from the psychological side is transplant distress levels may also be high after the transplant. Survivors continue to experience psychological distress related to the fear of recurrence, fear of secondary malignancies, body image issues, sexual functioning difficulties, distress about their families, and uncertainty about the future. And also often career-wise professional reintegration concerns. Young age, okay, we go, I think it's the next slide. No, the next one, I think, yeah, yes. Several factors make living with leukemia in the younger population particularly difficult. Cancer treatments can disrupt normal developmental experiences, including absence from your school or college or university, absence from a job and maybe a new job, social activities and interactions. So missing out on a lot of happenings, long periods away from friends, from academia and sport, sometimes even to repeat a year of your studies, are all detrimental to the psychological health of the younger AML age. Younger people also haven't had as much life experience to gain the tools to navigate difficult emotions or even to express their emotions and have less understanding of what is going on. Survivors of childhood leukemia may experience life differently from their peers and siblings, even after entering remission. These studies show higher rates of depression and anxiety, lower quality of life, and negative self-image in younger people with leukemia. Parents, because of their own fears and their own anxiety, may also be overprotective of their children after leukemia, making it harder for kids to connect with friends and other activities. Because there is so many developmental elements at play, it can be helpful, and it is very helpful to participate in psychotherapeutic sessions during and after the illness to understand the effect of AML on the development of a child or a younger person, but also on the whole family. Parents often develop their own post-traumatic stress reaction and can also develop depression or anxiety. The next slide, end of treatment, the element of chronicity. Thank you. Although your physical symptoms improve after completion of your treatment, psychosocial distress can be persistent over a longer period of time. So reaching the end of your treatment can bring a whole set of new challenges as you begin to recover from your physical, your practical, and the emotional demands that treatment caused. Some people describe this as a time of feeling lost and abandoned, literally by the medical team, and uncertain where they fit in. A little bit of feeling like in limbo. In the framework of chronicity, cancer survivors often report that they were uninformed and unprepared for the complex rehabilitation process and persistent or sometimes persistent symptoms of depression or anxiety or other delayed side effects after the end of the treatment. And I want to say something here from my own experience in therapy, that it is quite normal to have negative feelings after your treatment ends, which is so contrary to what survivors are told, to how thankful you must be and life goes on and to be very positive, which is all true. But hearing in therapy that negative feelings and uncertainty are normal and okay can be quite deliberated and cause less need. I also often find in therapy that the family and the friends might expect a person to go or to feel back to normal once the treatment is finished. But your body and your emotions need time to recover, need time to work through all that has happened. You may also, as a patient, have gone through treatment with the goal of getting back to normal. But now it is not so much getting back to normal, but finding out what is normal for you now, your new normal, if I can call it that, developing a new rhythm in your life. And with that, a psychologist can effectively help you. So one of my therapeutic goals in remission therapy are realistic expectations of yourself and your future, and to equip a patient with the knowledge that lifetime follow-ups and care or potential long-term treatment residue will be necessary to achieve and maintain the quality of life. The next slide will be overcome resistance. Yes. Again, psychology in cancer care of AML. And yes, there is still a lot of resistance, both from the medical community and patients, to participate in a psychotherapeutic process, mostly because of the stigma to psychiatric problems and seeing a psychologist. There is quite a lot of evidence that shows that the active participation of the surgeon or the hematologist or the oncologist through referring the patient during the treatment and explaining the importance to the patient of seeing a psychologist as part of their holistic treatment plan is helpful in reducing the stigma of psychological help in the cancer population. We need the medical doctors to be on board with agreeing with the psychological side of cancer and to refer a patient to a psychologist already in the early stages of the treatment. And it is my own experience, that the most common referral resources come from the patients and not necessarily from the medical fraternity. It is important for oncology physicians to understand the importance of not only acknowledging their patient's emotional experience, but also discuss it with them. So to increase their own awareness of their psychological symptoms, which might enable them to seek for psychological help. The barriers that keep many patients from benefiting from psychological care services, including the under-recognition of the need for psychosocial care by the primary oncology team. And even when recognized, the lack of professionals available in many communities to provide psychological care to cancer patients. So how does the future of well-being, I think this is on the next slide. The future the next slide. Oh, yes. Sorry, the previous slide. Sorry. Yes. So how does the future of well-being or mental health support for people with AML and carers look like? AML is a devastating experience, and attention to the burden of psychiatric and psychosocial consequences of illness must be seen as mandatory for both the cancer and the mental health care professionals. The International Psycho-Oncology Society, IPOS, has recently advocated an international standard of quality care, which declares that all patients should have access to psychosocial care. They request that quality cancer care must integrate the psychological field in and that distress should be measured as the sixth vital sign. A future aim from psychology must include a firm commitment from cancer care professionals to encourage closer connections between onco-psychologists and health practitioners, health policy makers, and health authorities, and that the AML patient and their family should have access to the full range of multidisciplinary treatment options. To me, we put a lot of emphasis on prevention of psychiatric or psychological conditions. I find that if the AML patient and family is referred from the beginning of their diagnosis, they get to trust you more, they feel more comfortable talking about how they feel, they understand their own psychological process better, and if they do need psychological treatment later on, they feel more comfortable to make an appointment. So the next slide, and the last one, and I want you to end with to say thank you for listening to me. I sincerely hope that I've made an impact on your psychological well-being and quality of life. Thank you very much. So is there any questions? We've got 10 minutes for questions that you would like to ask me.
I have several questions because anxiety and depression does not always appear right after treatment. It can appear many years after. And our problem also in our country, in Denmark, not many hematologists understand that it will appear many years after. And another problem is that the psychologists that you can find are not aware of cancer-related emotions. They are aware. Then you have to look very far for getting one who knows about that. That's a big issue. Do you have that also in your country?
Well, in South Africa, yes, we are very few specialists in oncology from the side of psychology, and it's very recently that the whole oncology fraternity actually involves psychology in treating cancer. You know, previous years, a couple of years ago, it was only treating the tumor or only treating the cancer with very little emphasis on the psychological side. So unfortunately, there's not a lot of psychological specialists as yet. So we also try to make the universities more aware of specializing in oncology or oncology. But it is a problem here also to find a psychologist understanding the specific side effects of all the treatment regimes, like chemotherapy have their set of side effects, psychological side effects, and radiation and surgery, and bone marrow transplant. So I agree with you that it's not an easy road to follow, But
Mm.
but just what you said earlier is that's why we try so hard, or I try so hard with a oncologist or the hematologist to refer a patient when they're actively busy with treatment, even for one session, just to introduce a psychologist. And very often, you know yourself, when you're in the treatment, there's not a lot of space or time for active psychotherapy. But then later on, when you then get depressed or anxious, then you can relate back to that. And it's easier to then make an appointment with a psychologist.
Mm-hmm.
If that answers your question.
Yeah, it is, because it's very difficult to find one who knows about it.
Yes.
We need some more psychologists who
Yes.
are educated in that. And then another question: is it possible to make a guideline for or examples how you feel after a treatment? Because maybe a leaflet or something guides you to think that this is normal and that's okay. Because we need that in our country. Maybe I think about it now. I heard your session because so many people are going around and feeling bad after a treatment and doesn't get this psychological help as they
Yes.
need.